So sinus augmentation, some people actually call it sinus lift. It's about providing more bone in the backside, the posterior side of the upper jaw, what we call maxilla. The situation calls for it because when the baby is born, the sinus is very small. But as we grow, the baby is growing, the sinus gets bigger and bigger because the sinus area is right inside our cheekbone, is right below our eyes, and right above our maxilla, which is the upper jaw. And there's an empty space which is communicating with your nasal sinus, with your breathing. And that is empty. But why do we have to get in there? The question is, after the tooth is being extracted or broken, it's been lost, the bone itself in the back that's been holding your tooth is decreasing because it's resorbing away, because it's washing away. Because our maxilla is right below the sinus, so sinus, instead of increasing its volume, is pressing on it. So the sinus is getting increasing more towards the bone of the maxillary bone. So when that happens, we have a very little bit of bone left. But that's when you actually come and find me. Most people come in and then say, hey, Dr. Han, I can't get my implants in there, so I'm wearing a denture. And I said, why not? Because they said, dentist saying, I can't get the implants in there, so you have to wear a denture. But maybe that is an option, but with the sinus lift procedure, sinus augmentation, I can recreate the bone that you have lost by inserting the bone underneath where the sinus has been increasing. So it sounds very scary. I'm not saying I'm gonna go in there into the sinus and fill up all your sinus with bone, not all the way to the eye level. No, we're not getting in there. Just imagine your sinus itself, let's say volume-wise, 15 to 20 cc's or up to 40 cc's. Your bone that I'm lifting, maybe up to maybe 2 cc's maximum. Instead of saying the best candidate, the worst candidate for sinus augmentation is the ones who actually has sinus issues. If you've been having a lot of sinusitis, you know who you are. You'll be seeing your ENTs every month, every week, and you have just inflamed sinuses all the time. Your sinus is all clogged out all the time, and you're taking the medication, it's not resolving anything, then you might not be a good candidate for a sinus lift. But of course, that doesn't not mean you cannot get an implant right away in the future. So come and find me, and then I'll be able to determine whether you cannot get an implant because you cannot get a sinus lift. But from my experience for the last decade or so, I find that there are only very few candidates where they cannot do the sinus, they cannot receive the sinus lift without complications. But if you do, then we'll find a way. So don't get discouraged. We'll find a way.